Welcome to Fertility Friday Q&A, where we go over all of your fertility-related questions, episode 3. Hi friends, I am Dr. Natalie Crawford. I am a board-certified fertility doctor, and I would love it if you would subscribe to the channel to learn more about your fertility and your body. Today, we are answering your fertility questions. So if you go to the community tab, feel free to write your question in, and every Friday, I am answering a few of them so we can all learn more about our bodies together. Let's dive in. If a person with a uterus once had regular cycles and then develops PCOS-type symptoms, such as irregular cycles, can rectifying factors such as stress, vitamin deficiencies, and weight return the patient's cycle back to normal? Good question. This totally depends. So first of all, let's address the fact that we said if a person with a uterus instead of women. I love inclusive language when it comes to periods and to your bodies. And so let's all try to remember to do more of this. So props to you, Martha. Thank you. Secondly, it really does depend on what is happening. So if you have irregular cycles and you think it's PCOS, there are sometimes lifestyle-based factors that can make a difference for you. I will use the caveat that sometimes it's not. So I like to think of PCOS like a teeter-totter. PCOS is a condition where your ovaries are failing to respond to the normal signals from the brain. This is because there are a lot of eggs inside that vault, and a lot of eggs are released every month. I have a whole video on PCOS so you can learn more. What happens is that from those eggs, when the brain sends out the normal signal, it's not strong enough. It gets diluted amongst them all. And so they don't really get to grow and to ovulate predictably or reliably. Sometimes they will ovulate at random intervals after a prolonged exposure. And what happens is that the ovary gets really bored. The ovary, my favorite organ, is a hormone-making factory, and its hormone du jour is estrogen. It makes estrogen when you are ovulating in high levels. Otherwise, it's not doing very much. And so what happens is the stimulus to make testosterone or androgens gets really favorable. So the hallmark of PCOS and PCOS-like symptoms is irregular cycles, an increase in acne, an increase of hair growth, and then there are certain ultrasound findings that we can see. Now, depending on your life, these things are going to fluctuate. So one thing we know about PCOS is that diet can make an impact on ovulation. So a great study did show us that the more servings of plant-based protein over animal-based protein, you had higher chances of ovulating. That doesn't mean you have to be totally vegan like I am. You can just favor plants or be plant-based in a lot of your meals, and that's going to be helping you. So I usually tell my PCO patients to say, okay, well, if I eat 3 meals in a day, let me consider only having meat in one of them. Further, it does look like red meat is more inflammatory than other types of meat, so remember that all animal products are not created equally. In the dairy studies, it did show that full-fat dairy was better than low-fat dairy. So if you're going to have dairy, I usually say in moderation, and make sure that you are picking those full-fat options and not something that's been processed. Processed foods and refined carbohydrates are also on the not good list for PCOS. For PCOS patients, we don't want to be taking anything that's going to make you an increased chance of being insulin resistant, because that's a part of the metabolic process that we see here. So fiber is good, carbs are good, whole grain carbs are good. You don't have to be gluten-free, you don't have to be keto. Stop thinking all of that. Weight can definitely be a factor. So as you gain weight, fat cells make a different form of estrogen, and this estrogen actually confuses the brain and tells it to send less of that FSH signal. So if we are losing weight, we then have less fat cells, they're making less estrone, our brain then gets a little bit released from the suppression, and that may cue you into ovulating. Studies have shown that losing 10% of your body weight, even 5%, can make a difference if you're overweight. Remember that not all patients with PCOS are overweight, so if you're a thin PCOS patient, please don't lose any weight. This is only if you are overweight or obese that losing that weight may show a difference. Stress is highly important. We do think that PCOS patients respond to stress differently. We see an increased stress response to certain types of activity and exercise, so high intensity exercise like HIIT classes. Love me some HIIT classes on my Peloton, but I don't have PCOS. If you have PCOS, you might find that it's harder for you to recover from these because of the increased cortisol spike, and that's going to be harder on your brain and your hormones and your body. And so actually like prolonged, more moderate exercise for patients with PCOS when they're trying to normalize things. Sleep is essential. try to get more sleep. I know we're all terrible about it. And vitamin deficiencies, like vitamin D is a huge one that overlaps with PCOS a lot. So almost everybody needs a little bit of extra supplemental vitamin D. Is 21 too young to freeze your eggs? The short answer is no. Every single person is different. If you know that you are waiting for your future and you're not ready to get pregnant anytime soon, and it's going to make you feel better to keep that opportunity and that door open, then it can be worth the investment to go freeze your eggs at a younger age. The younger you are, the more eggs you have and the better opportunities you're going to have. That being said, most people don't need to freeze their eggs as young as age 21. You usually can wait a little bit longer to see what your future is holding, but that's not everybody. And I've certainly had young patients go into ovarian failure in their 20s, and 21 would have been a fabulous time to freeze their eggs. So if it's something that's already on your radar, it is usually worth exploring. And my general answer to the question is, when is the right time to freeze my eggs? I would say it's the time you're asking the question. If you're asking about it, you have more eggs now than you're ever going to have, and they're going to be the best quality that they're going to be because you're the youngest that you're going to be. So at least considering an evaluation or understanding the process could be helpful. But in short answer, would we freeze a 21-year-old's eggs? Absolutely. Is it typical for a fertility doctor to not give results and talk about results until all fertility tests are completed? My husband and I are finding this frustrating and wondering about the reasoning. You know, we all do things a little bit different in transparency. At my practice at Fora, what we do is we release your results to the portal so you see them and you find them. But then we have a sit down visit, a follow up once we have them all and explain them and go over the testing. Some clinics don't give you results at all. Some have a nurse call and go over every result. The reality is that a lot of the results don't mean much without the other factors. So wanting to understand the full picture is really going to answer all the information you need. That said, if one result comes back highly abnormal and doesn't depend on anything else, a great example is azoospermia, having no sperm. Well, that changes everything. Do I need to wait on a test to see if your fallopian tubes are open if you have no sperm? Probably not. We need to have an initial discussion about that. And so I think every clinic does different. It's really important. And one of the things I tell people to ask a clinic when they're trying to decide where to go is ask your clinic, what do they do? How do they communicate test results? What are the expectations? I find that if you're having your expectations met, even if it's not your ideal world, that's going to be better than nothing. And then I worked one place where we actually put them in the mail and mailed them, like snail mail. That's when I was in fellowship. And at the time I was like, I'm not snail mailing these. I started emailing them to patients because, I mean, who checks their mail? But I think that knowing how your clinic communicates is going to be really important. Do you have one nurse? Is there a team of nurses? Is there a portal, email, a phone call? Phone calls are hard too. You have to answer your phone and then somebody's telling you something and you're trying to write it down. There's nothing to see. For those of us who are more visual, I much prefer something that's going to give me the number and let me understand what it is. But ask your clinic. That can be a way some of us do things. After stopping Depo-Provera injection, how long should it take your period to regulate itself out? I hate Depo-Provera. It's my least favorite. Okay, so Depo-Provera is the shot. So if you've heard of the birth control pill shot, what it really is, it is a high dose of progesterone. And this shot is such a high dose that it's telling the brain to stop sending out any hormones at all until you don't ovulate and you don't have a period. It's good for contraception because you don't have to think about it for 3 months. You get the shot in a dose that it's going to definitely prevent ovulation for a 3-month interval. However, it can prohibit ovulation for up to an 18-month interval. Oh, 18 months. Okay, so if you get a Depo-Provera shot now and you say, I want to start trying for a baby in 3 months, no, that's a terrible idea. Your doctor hopefully is counseling you out of that. We typically should see your period come back at that 3-month interval if the brain is kicking back on, but it definitely can take longer. And so I tell patients it can take anywhere from 3 to 18 months after your last Depo shot to get back to normal. If you're outside that window and your last Depo was 2 years ago and your periods are irregular, that has nothing to do with Depo-Provera now. I do caution that it's not the best contraceptive of choice for most people in the proximal time to wanting to get pregnant. Meaning if you want to get pregnant soon, I'd rather you stop the Depo and get onto an option that doesn't have such a profound suppressive effect. Hi, could you explain what happens when one of the fallopian tubes is removed? You can get pregnant if you ovulate in the healthy side. Does it take more time to get pregnant? I've read from Facebook that the healthy tube could catch the egg from the other side. Is that true? Thanks. Love your channel. Thanks for loving the channel. Okay, a whole video on tubes. So yay, go check out and learn more about your tubes. But the short answer is yes, a tube can pick up an egg from the other side. The tubes are mobile in the body. They're not just fixed in one spot. And so even if you have one removed, that other tube can move around and it can get an egg from the other side. So can it happen? For sure. Is that the most probable thing to happen? Probably not. So I usually counsel patients that I expect a decrease in your fertility overall versus in somebody your same age with two tubes, purely because some months it is less likely that egg and tube can meet, but they have an attraction policy. The tube likes the egg and tries to suck it up inside of it. So it likes to move to where it is. And so it certainly can happen. And we know, we see patients all the time who have a tube removed and they only have an ovary on the side where there's no tube, and they can get pregnant naturally. So one, that's not birth control, so don't think that it is. And two, even if it's a slightly less chance than natural, it can happen. My other caveat though is, well, why did the tube get removed? And is this an indication of underlying tubal disease? Because you may have a lower chance of getting pregnant overall because of an underlying factor like endometriosis or bad scar tissue. If you had a tubal pregnancy, then you have a significantly higher, 7 to 10 times higher chance of having a tubal pregnancy in the future. And so is relying on that fallopian tube the smartest choice? Definitely talk to your doctor, understanding why that tube was removed and what the best options are for you moving forward. Thanks so much. I hope you guys enjoyed this episode of Fertility Friday Q&A. Quick reminder, you can go to the community tab, and that is where you can pop all of your fertility related questions, and I will get to them week by week. Would love it if you would subscribe to the channel to help spread our message of fertility education and body awareness. You can also follow me on Instagram at Natalie Crawford MD, or listen to the As a Woman podcast for more fertility-based information. Thanks, friends.